Welcome to the Northeast Kingdom Voice. I'm your host, Scott Wheeler. Today's guests are Mindy Starr and Danielle Wright. They are here today to talk about occupational medicine. Welcome to the show.
Thank you for having us.
Yeah, and I know you were thrilled about coming on. You just couldn't wait to be in front of the camera.
Right. I'm really camera shy, so this is good.
Right. Okay, Danielle, first of all, who are you and what is your job?
My name is Danielle Wright, and I'm the clinic manager for Dr. Leslie Lockridge, or Northeast Kingdom Hematology Oncology, who we give services for oncology patients, hematology, internal med, and we've also just added on a psychiatrist named Sally Catherine Matheson, who services were very much needed in the community. We have last month added occupational medicine, and that's why Mindy is here with me today.
Okay, Mindy.
So we started a new company called Northeast Kingdom Medical Concepts to join on with Northeast Kingdom Hematology Oncology. It bases on occupational medicine in the area. I have 15 years of experience in occupational medicine. I'm a provider and I do medical examinations. We've brought Dr. Bruce Latham back to the area. He worked in Island Pond for a bit, and we're trying to continue the occupational medicine for all of the community.
So since today's is occupational medicine, just explain a little bit, Mindy, what is it?
So occupational medicine has a lot of factors. Most of them is for employees. A lot of the factors being workers' compensation claims, screening for pre-placement. So if a company was to hire somebody, we screen them to make sure they didn't have past workers' compensation claims. And if they have a disability, that may limit them in the job that they're going to look to hire them in. We do drug screening to make sure that employee is screened to make sure that they're clean to be working in an environment, safety-friendly environments. We have on-site nursing at Columbia Forest Products, which helps with oversight in a factory setting. We deal with immunizations, permanency impairments, primary care we're taking, quick care, walk-ins for basic necessities. We handle bloodborne pathogens. We've done a lot with the prison for that. A lot of the community has heard throughout numerous ways because of the panhandle of how occupational medicine started in the community. The physician that was known has left and went to Maine. However, we've brought a new physician that handles occupational medicine. So a lot of the companies around here are not aware of it. A big thing that occupational medicine does is the federal motor vehicle safety. That's DOT certifications and medical examinations for Department of Motor Vehicles. Examples of that would be Pool and Grain, Bear-Up Farms. All these truckers have to be certified and cleared to be able to drive a truck, and there's very few medical examiners in the state of Vermont and New Hampshire currently.
And your office provides that?
Correct.
Right. Now, what is the benefit to the, besides, obviously offering immunizations and such, but how does the business such as Columbia benefit from you? Are you also keeping your employees healthy?
So a lot of it is state insurance and other insurances are making guidelines of how you can follow a wellness program to keep fit. That is for employees, but that's also for employers. That gives these larger corporations or companies the in on keeping their insurance low that they pay for their employees by having a healthy workforce. The biggest benefit in a factory setting is when you have a nurse on site, you're lessening the amount of workers' compensation claims because there's immediate action, there's a care plan, there's somebody there to do a work site evaluation because maybe the person wasn't doing their job correctly in their work environment, which caused hazard. A lot of larger companies would understand this, knowing it being there's a percent rate when you pay workers' comp. The more claims you have, the more you pay towards workers' comp.
Right. Now, do you also deal with repetitive motion injuries?
Yes, and actually the new physician that we brought on is a doctor of osteopathy. So for those of you that don't understand that, he's a physician that knows the body the bones, so a lot of repetitive motion, carpal tunnel syndrome, Deger veins, or repetitive back, a lot of back injuries and a lot of back pain.
You know, one of my sons is a manager for Columbia Forest Products, but in Presque Isle, Maine. And I was telling him back in my day, before I went to college, I worked for a bit at Columbia. And I remember every once in a while the chewing tobacco companies would come in and set up shop and
Yep.
give away free. Do you, you know, we're a health conscious society now. Do you have chewing tobacco companies roll in now and give away?
No, and actually Columbia Forest Products and a lot of other companies and high schools, we worked on a wellness program that's been pitched to UCLA. I was one of the people that created a program showing these companies that if they put in their vending machines apples, oranges, water, takeaway soda, that the benefits would not only make their employees healthier, less call-ins. There's a lot of significant value in just demonstrating healthy work environments and a healthy behavior. And
Right. Now, how does this benefit your practice?
Well, it gives our practice a chance to give back to the community. People were going to have to travel a long ways to be able to get these benefits. And, you know, it just came, we're trying to be very community-minded and trying to bring in things that the community needs in this area. There's been a lot of needs that we're trying to evaluate and bring in because they're no longer available here, and people are needing it. You know, we have to do it for the people, for our patients. Our patients deserve the best, and that's what we all aim to do at our office.
You know, with Dr. Lockridge, he's been around here for quite some time. So he was known largely at one point as the cancer doctor, as a oncologist. But now that he's out there, he's building up a real clinic.
Yes, we see, I think, internal med and oncology. We probably, it's probably about 60-40% right now. 60% of internal med, probably 40% of cancer patients that we currently see. And he oversees chemotherapy. The chemotherapy treatments are still being done at North Country Hospital. And we do all injections in regards to their treatments that they have at the office, so that Dr. Lockridge and the nurse can better assess the patients when they come in to see what's going on. You know, the day after chemo, they get an injection, and that way the nurse can assess, you know, if they've had issues with their chemo. And Dr. Lockridge is right here in the office.
I'm really hoping that eventually, once all this health care, you know, the insurance and the Obamacare, the Shumlin care, and once it all sugars out, I still hope that whatever we end up with allows more doctors to work independently. I don't mean just here, but everywhere, because I have been going to an independent doctor for years, Dr. Wood,
Mm-hmm.
and he's ticking down on his
Mm-hmm.
years there, and so because I'm looking for an independent doctor. And I'm hoping that there's going to be more of that in the future.
I think by this healthcare, a lot of the clinics have been bought up by different hospitals. So some of the providers have lost some of their individuality of, you know, doing services in the way they would like to see them. They're kind of mandated to see so many patients a day, or you know, only to see them for one or two things because their time is limited every day. At our office, we try not to do that. You know, we give every patient a half an hour follow-up. We don't deal with one issue at a time. If they have multiple issues, Les is always open to hear what's going on in their lives and try to deal with their medical or psychiatry issues. Kat is always on board too. I think we're not in a set
Right.
setting where we have to do things a certain way. We have a little bit more independence to maybe do a little bit more research on something, or I myself work really hard with patient assistance, people who can't afford treatments. I've got probably 15 to 20 people that I work with to try to find financing for patients who can't get covered for their medicines that they may need. I bet you I probably find about $300,000 to $400,000 a year of patient assistance money to help patients who can't afford health care or their treatments that they need.
How is, might be a little off our topic, but with all this insurance, with Obamacare and such, I understand that you are seeing more, well, most providers are starting to see more people who are covered by insurance. Is that the case?
Yes, most of our patients are, I bet you we probably have a 98 to 99% patient base that are covered by insurances. Some of them are Medicaid, but at least they have some type of coverage that come to our office. We are open to see patients without insurance, and we are willing to work with patients with payment options. Also, we have we've done some fundraising to do patient assistance, and some people in the community have donated money to that, and that money directly goes to the patients. If there's a patient that comes in and just cannot afford their $15 medicine at the drugstore or $30 medicine, we can go to this fund and help the people get what they need.
And I know we also have that great fund out there, the HALO.
And the HALO Foundation, we can't say enough about what they do for us. We can give them a call and say, one of our patients, has this big copay, a $500 copay, to get, let's say, a brace that they really need because of what's going on, and the insurance will only cover 80% of it. They don't have secondary insurance. The HALO Foundation has helped numerous patients in that, and they've also dropped off gas cards that we give to our patients who have to come in for treatments to help them with that kind of expense that's hard to do on a Social Security income or whatever, or no income or a disability income. We try to help as many as we've actually started also getting grocery cards from Price Chopper to help some of our patients, because we hear that they are choosing between eating or their medicine. So once in a while, when we hear that, we will give them a gift card that they can go up to Price Chopper to get food only. The card is specifically made just to get food, and the patient can go up. And
I think one thing that people like about whether it's donating money to your program there or to the HALO is they know all the money stays local and it isn't being eaten up by administrative.
right.
So-
Dr. Lockridge and I started this program when we opened up, because we knew that the need was there. And the HALO Foundation at the time worked with us, were behind us at the time, helping us create this fund so that patients could get help. We've always had great support from the HALO Foundation. It's a needed thing in this area. You never know what expenses these people will incur who are getting treatments. We don't just use the Patient Assistance Fund at the office just for cancer patients, but that seems to be the biggest share of the patients who need it.
Right. So it sounds like you're a really great team. You have the oncology portion, you have the primary care portion, then you have Kat, who
Yeah.
provides the psychiatry, and a lot of times medicine and psychiatry sometimes
They
go
work
yeah,
side by
definitely.
side.
hand in hand, and sometimes it takes. I think it's interesting how you guys work in such a small area on Union Street.
Yeah.
You're right there, so I don't know if Kat can just. I don't know if you can move patients back and forth that easy, but it seems like. And what about you, Mindy? Do your people? Are you able to recommend
Yeah,
their
definitely.
services?
Definitely, and I think most of the patients that have seen where we've moved have fallen in love with the new physician that came for occupational medicine, but along the same guidelines, no, now they have a fallback. It's a clinic where everybody cares. So if Dr. Latham couldn't see a patient, you have Dr. Lockridge, or if we have a patient that we feel needed to have psych help, then we have that physician there as well, and it's one stop versus being sent all over the area or being sent to Dartmouth and Fletcher Allen. There's a little community there
Yeah, it's in it,
in its own.
and it continues to expand.
Correct.
You've taken over the whole building now.
Yeah, we own the whole building. Dr. Paul Julian is still with us for the ear, nose, and throat, 2 days a week at Newport. He rents the space from us, and he still sees his patients there. And then we have Catherine Matheson, or Cat, that sees patients 3 full days a week. So it's a juggling act between the rooms sometimes. It's making sure that everybody has the rooms that they need for the day that they're there. We have a couple of others that we've wanted to bring in, and we're just looking at room space to see that they have a room available to see their patients all day.
Do both of you find that there is an interest amongst medical providers to work in a place that is privately owned?
Yes, we've had a couple of people directly contact us, or Les has known some people, and there's a lot more interest, I think, in the individuality of the providers being able to do that instead of being mandated by either corrections or
Right.
a hospital or a workplace. They're wanting to start to do their own thing.
So I should ask you that, Mindy, because you just joined the practice here. You moved your practice and joined up with them.
Correct.
What attracted you to join up with them?
A lot of it is independency, and I believe that no two people would like the same physician. Like, you have your friends out in society where there's a cookie cutter mold in other areas where they have guidelines they have to follow and they have practice that they need to follow, where when you're in an independent setting, that's an individuality. You're looking at the person as a whole. Dr. Latham, for instance, is a physician that sits and listens, and a lot of times that's all people want right now, is somebody to actually hear them when you feel like, and not all physicians can do that. And it's not that they don't want to, some of that comes from their job title. Like you and I might have a job title to do something, and it depends on the circumstances that you can practice medicine within, like you said with Dr. Wood.
Right. How has the transition gone from private to being a member of this team?
Well, that's a hard question for me because I worked for an organization for 13 years. And when I moved to a new part of that organization, which was occupational medicine, I've been in about 5 to 7 years now, we were cut off. We had guidelines to follow, but we weren't part of the organization, so to speak, because occupational medicine's very elite. It's not something all providers handle. It has different billing scales. It has different patient care. Visits are not mandated by minutes. It's mandated by the injury of the body. But when I left from the organization and went private, what I felt is that patients felt more comfortable. They felt that there was a reason we needed to be there just as much as the reason they were there. That we weren't just seeing them on this basis to bring in money.
Right. Now, are you the only one in this area, your group, that provides these services, or are there others?
As far as I know, we're the only ones in the area. The next closest would be NVRH, and we've worked with NVRH. I've had connections with them, and the problem is sending the community off for health care. It's not something that we need to be doing. We have organizations in this area that can do that.
You know what as again I said, I do like the idea of standalone clinics and that. It's like I've even had a person on my radio show who just moved here. She's a nurse, midwife, and she has come here. So it seems to me like there are more of these opportunities arising.
I agree, 100%.
Patients want to be known that the provider knows them, that they're just not a number, and that's what like our clinic offers. You know, some patients will go to a bigger facility and they'll say, they don't even remember my name, I'm just a number. Where they come to our office and, you know, they know us, they know they can come to us, and we try to figure, you know, their issues out, we talk to them. The one thing I've heard from a lot of our patients is we listen. We really listen to what they have to say. We're not, you know, typing our note on the computer while they're there. We wait till they have left, and you know, we try to do as much for the patients in this community. We try not to send them out.
You know, I've interviewed Dr. Fioramonti. I don't know if you recall Dr. Fioramonti or not.
I've heard of him.
Well, Dr. Fioramonti's in his 90s, and he was a doctor for many, many moons here, well before any of us were thought of. Like, back in his day, I think if I recall right, he would go to your house and deliver a baby for $15. If he delivered it at the hospital, it'd be $5. I'm not sure what an appointment would be like now for $5.
Yeah.
But he kind of, you know, he talks about how much medicine has changed. You know, granted, some of it had to change, and a lot of it's for the good. But he talked about not only did he, you know, do you know, sew up somebody's finger. He delivered babies. He did minor surgeries, and you know, those days probably had to change. But he kind of thinks, you know, healthcare to a degree has gotten so impersonal that you can't really care for people.
Well, I think that goes for the providers and for progression over the years. A lot of it is, back in the day, providers went into it to help patients.
Right.
Some people now are looking for their benefit for their future on goals, financials, and make different decisions to become providers. I believe there's providers out there that still care that much for their patient, that do make the house calls. But the hard part is most providers, the way that it works is there's a package deal. You're getting insurance, you're getting your life insurance, you're getting paid time off when you work for an organization. And that takes away from them. A provider doesn't then just have to care for their patients. They have this administrative business sense. So healthcare is no longer about health. It's also a business like every business you go to.
Well, that's interesting you say that, because Dr. Fioramonti also said that was one thing. Once big business realized that there was money to be made
Exactly.
in healthcare. I don't mean big business even locally, but I mean the
whole
grand
picture,
scheme of
yeah.
things. Like, you know, back in his day, he said if somebody didn't have the resources, he might, after making a call out to Holland, which he said sometimes required him to drive part of the way and have somebody pick him up with a horse on the other part to get out to the sticks. He said that might all be for a couple bucks and a bag full of vegetables.
But that's what we're missing in society, is that care, that there's enough care in the community, where even a neighbor, if they know that somebody has a health condition, to bring that person a few bags of food. It's not just healthcare, it's the stemming branch of the community.
I can tell you though, I personally, boy, I wouldn't want to be a doctor and hold, you know, or a medical person and hold somebody's life in my hands. I think it's I think it must be such a challenging job, always questioning yourself. Like you know, Dr. Lockridge has to, you know, sometimes make decisions that, you know, can seriously impact somebody's life.
Yeah, the one thing I must say about Dr. Lockridge is he does a lot of investigation, does a lot of checking into different testing that's going on, different clinical trials, and he'll keep fighting for you. He's on your side. I know that we've had patients that've gone through multiple cycles of different chemotherapies, and they've, added 5 to 10 years to their lives, but they want to be here. They have young children. They want somebody that's going to be on their side fighting for them. And I think the ones that we have feel that way. They know that he's there for them to see, and we'll even, work together with other clinical trials to try to get our patients into some of the clinical trials out there.
This is probably not a fair question to ask you. It's probably more towards Dr. Lockridge, but somebody just mentioned this to me. Is there really more cases of cancer now, or is it more, are we more aware of them? Or is that a question for the doctor?
I think that's a question for the doc. I think,
I think there's more.
I think there's more. I
cases.
myself personally think there's more cancer out there. And people are catching it earlier than they used to. And so they're able to get care sooner. But then you have some people that refuse to go to doctors, for a long, long time, and then they're, get tested, and all of a sudden they have a high stage of cancer. That it's kind of too late to much do anything.
And lately, and it's probably has always been true, but then you have these people who are outwardly healthy, they're in their 30s, but then all of a sudden they pop up with stage 4, some kind of cancer that typically is not seen in that young of a person. And so, I think that's just a lot of questions that people do have is really, are we seeing more cancer? Because it's, one thing though, is we talked about the Halo Fund and that. It's amazing. If somebody gets cancer, gets in an accident here, there's all these fundraisers that people really try to help out.
Right. This community is great about, you can't ask enough, say good enough for this community, because everybody in this community loves to help people, a lot of the people. If something tragic happens to a person, somebody will do a fundraiser, will try to help. And I think we have a great community-minded place here in Northeast Vermont.
What I tell people is this. We like to play together, we like to work together, we occasionally like to fight together, but usually when push comes to shove, people rally around one another. Okay, Mindy, as we wrap up here, if there's a business out there that is interested in your services, how can they contact you?
They can contact us at Northeast Kingdom Hematology Oncology.
And the number is?
And the number is 802-334-7177 or 9300. We're on Union Street in Newport. We're always welcome to have people walk in, and we look forward to helping anybody that needs it.
Right. Oh, talking about walk-in, I know in talking to the doctor, at one point you were considering having a little bit of a walk. How is that going?
We are still in talks to have that happen. We haven't made a full commitment to it at this point. We are in the process of talking to someone to do that. But like I said, we still haven't made a full commitment to.
We have been pretty good about people call to get
people
them in.
call, when Dr. Latham is there, Dr. Latham will see a lot of them in between. We are trying to get Dr. Latham, to fill his schedules, and he sees numerous patients while he's there. I don't know how he does it. He just goes from room to room and just gets it done. But we would like to offer some type of emergent care to help and do what Dr. Latham does, but Dr. Latham can't be there every day. So like I said, we're still in the process of trying to work something out there.
And Kat has been on my show a couple times, and I think she's such a huge asset because she's so down to earth, especially for she's not a psychiatrist, she's a nurse.
Practitioner,
Right.
psychiatrist, mental
And,
health.
but she's so down to earth. I can imagine she must have a great rapport with her
She
patients.
has a great rapport, and I think she has a great rapport with the staff. I think we all go into her room when we need to
Oh,
talk.
so you get psychoanalyzed every once in a while.
She's just a really good friend and a good, coworker.
Okay, final words. Mindy.
I want to thank you for having us here today, and I just want to let the community know that there is people out there that are hearing their messages about health care, and all of us are working together as a group to hopefully bring more services to the area.
Yeah.
Danielle.
Same thing. Thank you. We are here for the community, and please let us know if there's some services that you might like to see come. We are trying to get more and more services and to take care of this community here in the community, not to send you to other facilities.
Well, at the rate you're going, you're going to have a bigger facility.
And there's words of that.
No.
That's a whole nother story.
That's for another day.
Day, it is.
Okay, thank you both for coming on. And it really wasn't that bad, was it?
No, I
You
guess
don't want me to
not.
answer that.
Okay, thank you.
Thank you.
And thank you to the viewers for tuning in to another segment of the Northeast Kingdom Voice.